Physio Steve checking in with you today, talking about anterior knee pain. So a few of the things that you can do to help with this anterior knee pain is stretching out, like I said, the quad and the hip flexors. So I find this one to be helpful if you have a box and something that's soft on your knee. Big thing is making sure your pelvis is neutral. We don't want you arching through your back, but keeping the back and the pelvis neutral. And then just gently rocking your whole body forward. You'll feel the stretch on the leg that's down here. That's good for both the quad and the hip flexor. Another thing that you can do is, like I said, if you have a muscle stick or even a rolling pin at home if you're a baker, you can just sit with your leg relaxed and roll up and down just to the top of the knee and then back up to just below the hip with a decent amount of pressure, so you're working out that soft tissue and that tight quadricep muscle. Another thing you can also do if you have a foam roller at home, this one's a little bit more difficult, requires some maneuvering, but if you lay the foam roller flat and then rolling from the top of your knee to the bottom of the hip again, and you can control it with your upper body, and this way you can just go forwards and backwards. If you find a nice tight spot, you can relieve pressure, or you can roll up and down on that tight spot, focusing on trying to get anywhere from the inside, middle, and outside of your quad. So those are a couple things you can do to help with that tightness in the hip flexor and the quad. This is Physio Steve, checking out.